Hi everyone, watch parts 1 and 2 first. Here's a recap. VisionX software optimizes the panoramic curve and maps out the inferior alveolar canal for you using AI technology. This is a huge time savings. Dr. J. Reznick goes over a 3D volume and implant planning. This video will show you how he orders the surgical guide that he prints out in-house. He also shares a special indirect sinus lift technique that he developed. Enjoy the video.
Now, the way that we order the surgical guide is pretty straightforward. And actually, you know what I'm going to do, Mark?
What's that?
Is I'm going to show you a trick.
Okay, show me.
Okay. I published this in Implant Practice US, I think about a year ago, this technique that I came up with for doing indirect sinus lifts. So, you know, when you're doing indirect sinus lift, you are going to drill just short of the sinus floor and then use an osteotome to punch through and then add your bone. Well, this is my surgical guide plan, right? And you can see it's planned for an 11 millimeter implant. What's going to happen if I use my surgical guide following the protocol, I'm going to drill right through the bone and right into the sinus.
That's right.
So what I'm going to do is I'm going to trick everybody. And I'm going to shorten this to the smallest, shortest implant that I can. Oh, which is actually 6.3. And you can see how the 6.3 is going to come just to the floor of the sinus, right? Okay. And I'm going to have about a millimeter. Let's see. Let's go a little bit higher.
Because we know at the apical end that's a 2 millimeter.
Well, we know with the Astra you have a 1 mil. The drill goes 1 millimeter beyond the implant apex.
Okay.
So I know that my drill is going to go to about here, 1 millimeter beyond. All right. So I know. So what I'm going to do is I'm going to order a surgical guide for a 6.3 millimeter implant. This is what how I'm going to plan it, and that way, when the surgical guide, the surgical protocol is worked out, it's going to drill my osteotomy right to there
And stop.
Okay. Then I can get my osteotomes, my indirect sinus lift osteotomes, add a little bone in here as a cushion, and then tap up that floor of the sinus.
Wow.
And then once I've broken through, then I add my bone, and then I come back and I place the 11 millimeter implant.
Okay. So you're not drilling through the sinus floor.
Right.
You're packing it.
Short.
You're packing it and then tap it. So you're tenting that sinus floor instead in an indirect way. So
and so the reason I'm putting some bone here before I tap it through is that acts as a cushion to prevent the osteotome from potentially tearing the sinus membrane.
Got it. Okay.
So let's go back to ordering the surgical guide now. So let's say the surgical guide, so we're going to order for a 6.3. So I'm going to go here to order, and I'm going to look at what it's telling me, and this is my implant, 4.2 by 6.3 Astrotech EV, and this is going to be a narrow diameter, and then I'm going to add this to my shopping cart, and then basically prepare my order. And what it's going to do is it's going to get this order ready. It's going to log me into the CCAP portal, where I'm then going to log into my particular portal. And should I put in my info?
I could block it out if you'd like.
Okay.
And then I could call Xenia and tell her, don't order it.
No, we'll stop it before it gets to that point.
Okay. I'll block all this out for you.
Okay, thanks. Oh, sorry, I did .com. Forgot that. All right, now I can log in. So it'll log me into my portal. And don't memorize.
Okay. All right.
And then it'll ask me to complete my order.
Okay.
So it'll ask me, and we'll go all the way through except for the very last button.
Okay. Which one do you order?
So it asks me which kind of guide I want to create. And my two options are a digital guide and a rapid digital guide. And the difference between the two is the digital guide is actually designed by CCAT, and then it's looked at by a technician who then creates the STL file and then emails it back to you.
Okay.
and it takes about a day or two to get your STL file back, and they charge, as you can see, $130. What I do mostly are the rapid digital guides. A couple reasons. One is it cost me $20 for the surgical guide instead of $130, but also the turnaround is like 20 minutes. Okay, and the way that this is done, it's not designed by a technician. It's all designed by AI. Now, if there's a problem, if there's an issue, it kind of gets spit out, and a technician looks at it, then they get back to you to correct the problem. But and this can only be used for fully tooth-supported guides. Right.
Okay.
And if you're going to be printing it in your office, whereas with the digital guide, you could send it to a partner lab and have them print it for you. But if you've got a 3D printer in your office, then you can select this for printing in your own office. So I'm going to go ahead and select the Rapid Digital Guide.
Now, when you get that, is that ready to print, or do you have to mess with it in Mesh Mixer or another?
So when I
software?
when I get the STL file back, what I get is an STL file that is ready to be added, basically imported into my Formlabs software.
Okay.
So it's going to tell me here, 1990, hit next, and Rapid Digital Guide in Office Production. It's going to have all this info here, which you can block out.
I'll block out.
And then means of payment. Click, and then
I'll
go
block
ahead
that
and
out.
order. And then the final thing is going to ask you that all the way down here, you've got to read the conditions and accept them, and then you complete order, and then it goes ahead and uploads everything.
Okay.
And then you'll get an acknowledgement maybe, about 5 to 10 minutes later saying that they've received your upload. And generally about 20 minutes later, I get my STL file back. So if I can, actually, I should go back to my portal.
Oh, let's go back.
Let's go back.
Let me go back to Zoom to your portal.
Okay. Well, anyway, so if you go back to the portal, it's going to show you all your patients that you've made orders for, and it's going to give you two things. One is a drilling guide, the drilling protocol, which you print out. It's an PDF, and you print it out. And the other is the STL file for your actual surgical guide.
Okay, let me see if we can get you back to your portal.
Okay. So then what I do is I take that STL file, excuse me, and I open it in my Formlabs printer software. And what I need to do then is put the support legs on it, the little support, little support legs on the surgical guide, which it does automatically. But then I go back and make sure that, oh, there we go, we're in the port. Then I go back and make sure that there aren't any of those little struts that are right in the area where I'm going to put the guide sleeve. Okay. All right, so let's go to my orders here. Oh, there's a new update for my software. Okay, that's nice to know. So under orders, why is it letting me click?
Here, let me give you a control again. Maybe that's
okay.
why. There you go.
Okay, so I'm going to go under my orders.
If it's not letting you, tell me. Oh, there you go. Go.
There we go, orders. And then it's going to show all my orders here. Of course, it's going to show patient information, so you're going to have to.
I'll block that out. Hey, there's my buddy. I'm gonna.
Yeah. All right, let's pick on him.
Yeah, let's pick on him. All right. I love the guy. I'm gonna block him out.
Okay.
I owe him a phone call, by the way.
What's that?
I owe him a phone call.
Oh, okay. So here's your sleeve report.
Okay.
And so you're going to go and that just opens into a whatever PDF software you're using. So it shows your drilling protocol, and it shows which drills you're going to need, right? And so you're going to use the 9 to 11 drills because it's an 11 millimeter implant in his case. And we have all our information there.
Okay.
And that should be familiar to anyone who's using the Astra EV system. And then we have our digital guide, which we then download, and it goes into, in my case, it just goes into downloads, and then I transfer it into a folder for all my orders, and then I open that into the printer software.
And that's pretty straightforward. It's not.
So it's really straightforward. It takes about 5 minutes to do.
Okay.
Yeah. So,
And then from there, when you print right away or you stack
so
them?
yeah, generally, I mean, if I've got a couple orders that I'm doing, let's say that day, what I may do is just, put them all in a folder, and then first thing in the morning, I will send them all to the printer together. I'll batch print them, and then what happens, of course, after they're printed, then you've got to put them in a rinsing unit to get the resin off, so an alcohol bath, and then they go into a curing unit. So at that point, all those forms that I printed, so the planning, the implant plan, and that drilling protocol go along with everything else to the staff in the back office. So then what they're going to do once they have the surgical guide is they're going to take off all the little struts, they're going to smooth it off, and then they're going to use a guide sleeve that's appropriate for the implant that we're placing. Yeah, exactly. So that guide sleeve is going to then go into the surgical guide. And we've got a selection of, all the different guide sleeves for all the various implant systems that we use.
Where do you get the sleeves?
I order them directly from CCAT.
Okay.
Yeah. Yeah. So, and I think you can order them from other sources too, but I order them from CCAT. It's just easiest.
So you do all the planning the first visits?
It depends.
Okay.
So it depends why the patient's coming in. So a lot of my cases, the patients are coming in, and in the demographic in my practice area, I'm not doing a lot of fully edentulous cases and all on fours and all that. It's mostly, someone with a pretty high dental IQ has a first molar that was root canaled when they were 25, and now it's fractured and failed, and we took the tooth out and did a bone graft, and now we're ready to plan the implant. So they come back in for the planning session, and that's when we do the planning.
Got it.
So after the graft is healed. Now sometimes I have patients come in, let's say they broke number 8, and so the dentist sends them over. And of course, in a case like that, in the anterior aesthetic zone, you want to try to do an immediate implant if you can. So what I'm going to do is at that very first consult for extraction of the tooth, we're also going to get our CBCT and see if we have proper bone volume and proper bone volume in the right location to be able to place an immediate implant. So I want to make sure that I can place the implant in the right spot, and I want to make sure there's going to be enough bone around at least the apical half of the implant to stabilize it. So if that's favorable, then we'll do the implant planning right then and there. And when the patient schedules their surgery, we go ahead and I complete the planning process and order the surgical guide.
Got it.
And then generally, if someone's coming in, let's say they need 5 implants, they just come in for a first consult, we may do the preliminary consultation just on the computer in front of them, and then bring them back to do get the CAD CAM image and to finalize the treatment plan, give them their prescriptions for ahead of time, and go over the consent and all that.
Great.
Yeah.
Wow, you covered a ton. I'm going to have to break this up in a couple videos.
Okay.
So it's consumable easily for people to watch it.
Yeah. I guess we've been going for a while.
I will go ahead and send you the video to check it out before posting it and make sure you're okay with it.
Okay.
I really appreciate this, Dr.
Oh,
Reznick.
you're welcome, Mark.